Hi, everyone. I'm Elaine Quijano. It's good to be with you. Thanks for joining us. The White House Coronavirus Task Force held its first briefing since late April on Friday. The nation's top doctors and Vice President Mike Pence addressed the massive uptick of COVID-19 cases in parts of the country and urged the American people to listen to state and local health officials.
First, we want to share with you, as Dr. Birx will, what we're seeing in the rise of new cases that today surmounted 40,000 new cases in a single day.
The two top states with the largest increase in test positives are Texas and Arizona, followed by Florida, Mississippi, South Carolina, Alabama, Georgia, Louisiana, Nevada, and Utah. Those last few states are under still 10%, but we're tracking them closely.
Roughly half of the new cases are Americans under the age of 35. Which is, at a certain level, very encouraging news, as the experts tell us.
Again, asking this team, millennials and younger people in this country, to come and commit themselves. I agree with Ambassador Birx. We're very thankful that the group is now coming forward to get tested, but I also want this group to put into vigilant practice the importance of our social distancing.
You have an individual responsibility to yourself, but you have a societal responsibility. This is part of a process that we can be either part of the solution or part of the problem.
Nancy Cordes, Zeke Miller, and Marquise Francis join me now. Nancy is CBS News chief congressional correspondent. Zeke is a CBSN political contributor and White House reporter for the Associated Press. And Marquise is a national reporter and producer for Yahoo News. Welcome. It's great to see you all. Zeke, let me start with you. Why did the task force hold a briefing now? And how significant is it that President Trump wasn't there?
Well, you saw the United States hit its highest number of confirmed cases of COVID-19 today, and that trend, according to some of the experts, seems likely to continue. These high levels of spikes largely across the Sun Belt, and we heard a message of concern from the nation's leading public health experts up there on that stage today. It was notable that the president wasn't there. His main focus, and the event that he held today was about workforce development, but his main focus of the last several weeks has not been the virus per se. It has been the economic recovery on the back end of that public health crisis. But as we've seen these numbers tick up over the last several days, we have not heard really from the president on that. We've heard in a limited fashion from the vice president on that. In terms of the concern level, he's also focusing on the recovery aspect as well. But it is notable, though, that they put these public health officials, scientists back out there after essentially keeping them, off air over the last month or so, as they've tried to make the focus businesses opening up, people going back to work, and the lifting of these restrictions. It's coming as states are having to reimpose some of those restrictions. So it was necessary to hear from these scientists and these experts today. But it is still shocking in some ways that we have not heard from the president on this, and that the message from the federal government is listen to your state and local leaders. It's not a federal response, it's a state and local response.
And it was interesting. Dr. Anthony Fauci said now was not the time to assign blame for why there's been a resurgence of cases. Here's some more of what he had to say.
Let's take a look at this problem that we're facing now, this resurgence of cases. I don't think there's time enough now all day to try and analyze and figure out the multifaceted elements that went into that. Everything from maybe opening a little bit too early on some to opening at the right time, but not actually following the steps in an orderly fashion, to actually trying to follow the steps in an orderly fashion, but the citizenry did not feel that they wanted to do that for a number of reasons, likely because everyone feels the common feeling of being pent up for such a long period of time. So we're not going to say blame, we're not going to try and analyze it, but there is something that's very important.
So, Marquise, we know that several of the states with an increase in cases are ones the president praised in the early days of the outbreak. Is that problematic for the administration?
I think we're seeing it's definitely problematic. We're seeing a spike, as you mentioned, in these southern states, including states like Texas, where Governor Greg Abbott had to shut down bars today at 12 o'clock. And at one point, I believe even the vice president said, they're just these small outbreaks. But when you look at cities like Houston, Texas, which is, I believe, the third, it's the largest city in Texas and the fourth largest in the entire country. Where there's an outbreak there, it's a little bit more than just a small outbreak. And then you look at cities, states like Florida, there's also been just a dramatic increase in the number of COVID-19 cases, and folks have been going to the beach and they've been going out and getting drinks. And the governor there, DeSantis, had to also stop alcohol from being served. And unfortunately, for some reason, this science, this COVID-19 has become a thing that's gone along partisan lines. It should not necessarily be political to listen to science and to wear a mask, but we've seen a lot of these Republican, governor states going against a lot of what science says. And, a national poll, actually Yahoo News, YouGov poll says that 65% of Americans agree that masking up for the public should be mandatory. But we saw in that video, the vice president did not have a mask on. We saw Dr. Anthony Fauci and Dr. Birx had one on. But it's really hard, I believe, as a community in the country and Americans to really believe what you're hearing from your government when they're not following rules as well.
Right. Well, Nancy, Dr. Deborah Birx was the only task force member to explicitly tell people to wear masks. Vice President Pence said people should, quote, listen to local authorities. A number of Republican senators also weighed in on mandatory mask requirements. What are they saying, Nancy?
Well, Republican lawmakers are getting much more aggressive about just coming out and saying, you should all be wearing masks. This is something that they were reluctant to do even a few days ago. They didn't really want to cross the president's messaging because they knew that he himself was reluctant to wear a mask in any public situation. But now, I think they see that the cases are rising dramatically in many Republican states, frankly, and they realize that the message has to get out. And in some ways, they need to override the message that people are getting from the president and frankly, from the vice president as well. And so Mitch McConnell was at an event in Kentucky, and he just held up a mask a short time ago and said, everybody needs to be wearing one of these until we have a vaccine. Liz Cheney, Republican from Wyoming, just tweeted out a picture of her father, Dick Cheney, wearing a cowboy hat and a mask, urging people to go ahead and do that. And we've heard from some Republican lawmakers in the past 24, 48 hours who have said openly, yes, I think people should be wearing masks, but I know that the president feels differently about this. And so they're trying to, kind of change the conversation. But Vice President Pence was asked point blank, Elaine, should people wear masks? And instead, he said, as you pointed out, well, they should listen to state and local officials. And then our Paula Reed had a really fantastic question in response to that, which was, if people should be following their state and local officials, why is it that the Trump campaign is holding large rallies without distancing, without masks in many cases, first in Tulsa?
Nancy. Sorry to cut you off, but let's listen to that, because that is worth exploring. And it was a very direct question that she posed to the vice president during that. Let's listen to that sound.
Question for you, then a question for the doctors on childcare. Sure. On the campaign, it really does sound, though, like you're saying, do as we say, not as we do. You're telling people to listen to local officials, but in Tulsa, you defied local health officials to have an event that, even though you say it didn't result in a spike, dozens of Secret Service agents, dozens of campaign staffers are now quarantined after positive tests. And then in Arizona, one of the hardest hit states, you packed a church with young people who weren't wearing masks. So how can you say that the campaign is not part of the problem that Dr. Fauci laid out?
Well, I want to remind you again that the freedom of speech and the right to peaceably assemble is enshrined in the Constitution of the United States. And even in a health crisis, the American people don't forfeit our constitutional rights. And working with state officials, as we did in Oklahoma and as we did in Arizona, we're creating settings where people can choose to participate in the political process, and we'll continue to do that.
Like a 4th of July thing or something?
So, Nancy, I mean, that was that exchange that you were pointing out. I'm wondering, now that some of these Republicans are coming out and publicly telling people to wear masks, how does that jive with what they were saying maybe privately to you and other reporters sort of behind the scenes in the days and weeks leading up to this point? Because the science on this, Dr. Anthony Fauci's message on this, Dr. Deborah Birx's message on this has been the same, that masks are needed, masks are necessary. That has not changed.
Look, I don't think that the president was the only Republican who early on and maybe even recently was somewhat skeptical about the danger posed by the coronavirus and about the, the relative risks of wearing masks or not. We saw a lot of Republican lawmakers at the Capitol, even when they were asked to wear masks in committee hearings, refusing to do so. John Cornyn, Republican from Texas, sort of tweeted out a somewhat sarcastic picture of a bottle of Corona beer early on and said, "Don't panic," connoting that perhaps we were all just taking this too seriously. Well, Cornyn has now changed his tune, and he is now urging the federal government not to pull funding for testing sites in Texas. So I do think that there has been a shift among a number of Republican lawmakers on this issue, both those who shared the president's sentiments that this was overblown and maybe don't feel that way anymore, and those who believed all along that it was the right thing to do to wear a mask, for example, but didn't want to contradict what the leader of their party was saying in public.
Marquise, you mentioned a moment ago how this has been a politicized issue, but can you just repeat once more what that poll found? And that is, when you look at people's sort of ideas about wearing a mask, even though there is vocal pushback from some Americans about wearing a mask, that ultimately I think it sounds as though, at least from the numbers and the data, there is a belief that the science on this does point to wearing a mask as a necessary part of fighting COVID-19.
Yeah, absolutely. So that number was a new Yahoo News and YouGov poll shows that 65% of Americans now agree that masking up in public should be mandatory. And this does go along party lines. 86% of Democrats feel this way. And actually most Republicans, 54% also. So, once again, it's becoming a politicized thing, but, the science is there. And I think it is, even a bit dangerous to say that the president was a bit hesitant or going against, he didn't know if it would work, because we saw early on in Italy and different countries what it was doing to that community, that society. So to say that we were surprised that people are now, getting sick, dying, the elderly, we saw this coming. So I think we really have to hold our leadership and our governors and the White House accountable. And we knew what was coming, and now we have to, see how this plays out.
Let's turn to another topic. Zeke, the Trump administration is calling on the Supreme Court to invalidate the Affordable Care Act. What is their argument, and why are they trying now?
Their argument is several-fold. The Trump administration has joined Republican governors and largely Republican-led states in trying to invalidate President Obama's signature legislative accomplishment, arguing that, number one, once Congress repealed the individual the penalty for people not carrying health insurance as part of President Trump's tax bill from passed in 2017, that the Tax Cuts and Jobs Act, that somehow invalidated the rest of Obamacare, the rest of the Affordable Care Act. It's a legal strategy that we sort of anticipated. We've heard from the President, White House officials that that's what they believe. It's sort of in some ways doesn't jive with the fact that the president has complained about his inability to get rid of Obamacare legislatively. So they seem to think and they're implementing the law still, but the politics of it are kind of striking in the middle of a pandemic, in the middle of an economic recession, 5 months out from a presidential election, a move that would be deeply disruptive to the healthcare industry, removing insurance coverage for people without having a replacement locked in, because Congress and the president have failed to come together on any sort of substantive legislative changes to that law other than peeling back some of the in the case of the penalty for not carrying insurance. So that it's a kind of a striking move from the president. It fulfills a campaign promise, but if the Supreme Court actually went through with it, there's so many questions about how that would play out politically and also on the policy side.
Right. The context here is everything, coming at a time, as you point out, in the middle of a pandemic where health care is very much top of mind for so many Americans. All right, Nancy Cordes, Zeke Miller, and Marquise Francis, great to have your insight. Thank you so much.
You're welcome.
Thank you.